This is Thailand's worst week in its COVID-19 battle. There were 2 record-breaking days of new infections and 1 with a high of 233 deaths. Until the start of the current 3rd wave of the virus in April, Thailand had only about 30,000 COVID-19 cases in all. Since then, it's added more than 830,000. A delayed vaccine rollout has been the focus of much criticism directed at the government and the mixed messaging about preventative measures as the 3rd wave was just taking hold. The rapid spike in cases has led to heavy strain on the healthcare system, which is considered one of the best in the region. Volunteers have jumped in to fill the gaps.
To me, the existence of volunteer groups shows how the government has failed. So people have to help each other.
The Health Ministry has proposed an immunity decree that would prevent any legal action against frontline medical staff while working on COVID-19 patients. It says it's designed to help them do their jobs. But it would also protect those responsible for vaccine procurement, an area that has come under critical scrutiny from the opposition and pro-democracy protesters.
This can set a precedent if the government wants to be protected from their own actions. We have seen more people suing the government, targeting policymakers. I don't think people will go after frontline medical staff. I think the top officer will feel at ease if they have some kind of immunity.
Well, medical experts say a better supply and variety of vaccines are critical for the overall battle against COVID-19. More at-home testing should be the top priority.
While the recent wave started in Bangkok and other large cities, it has now spread to rural Thailand. And that's an added complication because there's limited access in these areas to healthcare and vaccines. But experts say more testing would help.
I think that the test is the key to help control the infections. Ideally, it should be free for all people, because if you have this test in your hands at home, you can monitor yourself. If you get infected, you can have self-home isolation.
Dr. PUTCHAROEN says it would also free up bed space and medical staff for those who need advanced care. And it would help protect some of the more vulnerable groups, the elderly and children, as the rates of COVID-19 spreading inside households increases. Scott Heidler, Al Jazeera, Bangkok.